Are you considering castrating your dog and would like some more information? I'm Teresa, I'm one of the directors here at Warren House Vets, and in this short video I'll cover 4 main things you should know about your dog castration. The purpose of castration in dogs is to deprive them of testosterone and render them infertile. This can be done either surgically or by chemical castration. Surgical castration is the removal of the testicles via a single skin incision. This directly removes the source of testosterone. It is fairly straightforward with minimal surgical risks or complications. Most importantly, it is a definitive solution and its effects are irreversible. Chemical castration is done by blocking the production of testosterone chemically, by giving injection of suprelorin, which is a GnRH analog. This tricks the brain into reducing stimulating hormones and production of testosterone drops within few weeks. The effect can last around 6 months before the injection has to be repeated. Using chemical castration as a long-term solution can, however, be a bit expensive, since one injection costs almost the same as the surgical castration. There are different opinions about the optimal timing for castration, but the current consensus seems to be after the age of 6 months for small dogs and around 12 to 18 months of age for medium and larger sized dogs. Sex hormones are involved in growth and development and have a range of effects on the tissues, which is why the castration should take place after physical and developmental maturity. Castrating larger breeds earlier makes them at higher risk of joint problems such as hip dysplasia and cruciate ligament issues. The primary goal of castration is to prevent unwanted pregnancies. By depriving the body of sex hormones, it also reduces the risk of testicular cancer, as well as affecting behaviour. You can think of testosterone as the courage and feistiness in your dogs, so some behavioural issues will improve with castration. It is, however, good to be aware that in some cases it is the testosterone that compensates for behavioural issues, and when that is removed, the behaviour becomes even worse. For these reasons, and to see how much the castration will affect the dog's personality, some owners choose a trial of chemical castration before proceeding with surgical castration. 1 to 3% of dogs have an undescended testicle, which means that just like humans, one or less frequently both testicles are still in the abdomen or in the inguinal canal. They continue producing testosterone, but they are at high risk of developing cancer. Testicles are designed to be in an environment with a lower temperature in the scrotum, not in the abdomen, which seems to play a role in the cancer development. Retained testicles can be removed, but it's a more complicated procedure. We can remove it via open surgery, or when the testicle is in the abdomen, we prefer the keyhole approach to improve the recovery time and reduce postoperative pain. This is one of the things we check for at our preoperative consultations. At our practice, these checks are compulsory for all animals undergoing general anesthesia, disregarding of age, and they are included in the price of surgical package. We check the future surgical side, other issues such as umbilical hernias, or potential hazards for anesthesia, such as heart murmur, etc. We hope that you find this video useful. If you have any questions related to your pet's surgery, please don't hesitate to contact the practice.